Thank you for your kind words, Doctor. Greeting and a warm welcome to one and all. Before initiating, I want to thank Organizing Committee, Department of Physiology, the Lakshmi Srinivasan Medical College and Hospital for giving me this opportunity. I am honored to be one of the speakers of today's event. So today, I am going to speak on an amazing topic, that is transgender anatomy. So before going into the topic, I just want to ask few questions for your own self-assessment. You can answer these questions in the chat box. So the first question here is, trans woman is female by birth, male by birth, both male and female by birth, or neither female or female. You can mention A, B, C, D, whichever your option is in the chat box. The next question is, would there be any anatomical differences between transgender and others? Yes, no, I don't know. You can mention anything. The third question is, are transgenders are intersexual beings? Yes, no, I don't know. Few more questions to complete the questionnaire. So which part of brain would be responsible for the transformation? Insular cortex, limbic components, hypothalamus, none of the above. If your answers are multiple, you can write A, B, C in the options. The last question here is, sexual identity and gender identity means the same? No, yes, or I don't know. So these are the few questions. You can answer these answers in the chat box. So let's get into the topic. So objectives of today's session is, we will learn about determining sex and what is transgender, what is the difference between intersex and transgender. I mean to say anatomical differences between intersex and transgender, and basic terminology to understand the anatomy of transgender and reasons for transformation into a transgender, and external, internal genital anatomy, neuroanatomical aspects, gender affirming surgeries, and post-surgery changes. So the transgender is the term which is not new for us. They are there in this world since our ancient times. The best example is Shikandi, who is an androgynous character in Mahabharata. So transgender people are seen in every region around the world, from every racial and ethnic background. Maybe your classmates, colleagues, neighbors, friends, and relatives. So they are there with us since long. So one thing we have to note that being transgender is not a disease or abnormality. But still, the transgender community is fighting for their basic human rights. I'm happy to say that they are making their way with grit and conviction to overcome discrimination. So transgenders are emerging with their success stories in every field, because after all, they are all humans like us. So here are few iconic transgender achievers who scripted history in India. So gender needs to be taught at schooling. So what is transgender? What it means to be? So already it was explained by Dr. Divya. Just I will give a small note about it. So transgender are those whose gender identity is different from gender they are thought to be at birth. So determining sex, that is the sex determination at birth, is usually
Ma'am,
determined.
ma'am,
Yes,
ma'am, sorry
yes,
to interrupt, ma'am.
yes.
Ma'am, are you having different slides, ma'am? Is the same slide? First slide is on for us.
No, my colleagues are able to see the present slide which I am showing. Gender needs to be taught at schooling.
Slides
That
are
is the
visible.
slide.
Slides are visible.
Okay.
No,
Am I audible, madam?
Yes, madam.
audible,
Very
ma'am.
clear.
Okay. Thank you so much. I think there is some internet issues. Please check.
Okay, ma'am. Okay, ma'am. Thank you.
Yeah, thank you. So talking about the determining of sex, the sex determination at birth is usually determined by the appearance of external anatomy, and prenatal determination can be done by using ultrasound. So most people never think about their what is their gender identity. It is because it matches with their sexual identity at birth. But very few people are different. When they start growing, their innate knowledge of who they are is different from their initially expected when they are born. So sex is a multifaceted, so it can be described in various forms. So first is the chromosomal sex, which was better explained by previous presenter, Dr. Selvi, where a chromosomal sex, male contains XY sex chromosomes and female is having XX chromosomes. And gonadal sex, where males have gonad, testes, and females are having ovaries. And fetal hormonal sex, hormones play a very vital role in sexual differentiation of brain. And there are prenatal hormones which determine the fetal hormonal sex. And internal morphologic sex, where we talk about internal genitalia, and external morphologic sex, and sex of brain, and also the birth sex, which is assigned at birth, and pubertal hormonal sex. So these are the various forms of sex which we can describe the sexual identity of a person. So next, coming back to our transgender. So gender identity and its role. So in simple terms to say, transgender woman lives as a woman today, but was thought to be a male when she was born. Similarly, a transgender man lives as a man today, but was thought to be a female, and some transgender people are neither consider themselves neither as male or female, and some are the combination of both the sexes. Next, about the difference between the transgender and intersex. It was already spoke by previous speakers, but I will just say a basic important anatomical difference. So the disorder of sex development means the intersex, leading to ambiguous genitalia. So it is mainly because of reproductive anatomy or genes. So like chromosomal factors, gonadal factors, hormonal factors, which are involved in causing ambiguous genitalia. So intersex have like they have reproductive anatomy or genes that don't typically fit definitions of male or female. So these anomalies are often discovered at birth. So here in this image, you can see his male external appearance, but internally, if you see, histologically, he may have ovaries, he's having ovaries inside, and also the testes, and also a developed penis is seen. So, such people who are having a reproductive biological anomalies, so those are considered to be intersex. On the other side, you can see a female here having a uh, small penis, that is hyperdeveloped penis, and we can see rudimentary uterus and ovaries here. So such anomalies are considered to be intersex individuals. So the main difference is transgender is a gender identity issue, but the intersex is determined by the biological characteristics. So this was explained by Dr. Selvi in the previous session, but we can just know the chromosomes are packed of genes found in every cell in the body. There are two types of chromosomes which are called as sex chromosomes, and usually the female baby has two X chromosomes and male are having one X and one Y. And if there is anomalies, numerical anomalies, it may result in sex chromosomal abnormalities. The most common varieties are Klinefelter's syndrome and Turner's syndrome. In Klinefelter syndrome, there is an extra copy of X chromosome where the males are quite gigantic here and with rudimentary secondary sexual characteristics like rudimentary penis and all. And there may be a presence of gynecomastia and delayed puberty or delayed or absence of adolescence. So all these may occur. So the long legs and short torso with broader hips compared to the other boys are all seen in Klinefelter's syndrome. So coming to the Turner syndrome, so the Turner syndrome, it is identified by like wide webbed neck, low set ears, broad chest with widely spaced nipples, and having anomalies with the palate or palate and even the anomalies in the heart, and there may be abnormalities at the elbows. So all these are included under Turner syndrome. Okay, next, just a confirmation. Am I audible and my screens are visible, right?
Yes, ma'am. Yes,
Yes,
ma'am. You're
ma'am.
audible.
Yes, ma'am.
If I'm not seen, no problem, but this presentation should be seen.
The slides are visible, ma'am.
Okay, that is enough for me.
Yeah.
Okay, next, moving on to sexual identity and gender identity, which was well explained by Dr. Divya. So, sexual identity means during prenatal life, we know the males are having that acrocentric Y chromosome. So, SRY gene, which is located on the Y chromosome, is always like it is responsible for maleness. So, presence of SRY gene, the gonads will differentiate into testis and further it grows as a male. Absence of SRY gene results in the development of female reproductive hormones. So hormones play a vital role in sexual differentiation, and disorders of sexual development, chromosomal, prenatal, hormonal sex may result in ambiguous genitalia. So gender sex is usually fixed, gender identity is usually fixed in the children around 2 to 3 years of age. So sexual identity is the sex which is assigned at birth because of their anatomy, external and internal anatomy. This gender identity, it is usually fixed by 2 to 3 years of age, and here uh, when the child starts growing from 2 to 3 years of age, they start identifying their own sex, and they start also identify the other's sex. So that is called as gender labeling. And children later, they realize that gender is a stable over time, and typically it becomes like a permanent feature. So the important of this is like some kids, they may not accept what they are. So that happens in few kids. So based on Nelson's pediatrics textbook, it says that approximately 1% of parents of 4 to 5, 11-year-old boys report that their son wished to be in the other sex. On the other hand, 3.5% of females of 4 to 11 years old, they wish to be boys. But very few among these children will have gender identity concerns when they grow into adolescence age. So persistence of this gender identity concerns are higher from adolescence to adulthood. So among these, majority identify themselves as transgenders and may pursue gender affirming medical intervention like hormone therapy or surgeries. I'm not going into terminology too much because already it was discussed in previous. So we know what is gender identity now, inner sense of gender, and who is a transgender, who is a trans man and trans woman. And we also understood about sexual orientation. And gender expansive, which is otherwise called as non-conforming, non-binary or gender queer. So this term is given to those individuals who can't fix them into neither male nor female. So they are confused about their gender identity. So the role that is assigned at birth but does not fit into the binary understanding of gender is called as gender expansive. And gender transmasculine and feminine I will show in the next slide. And gender dysphoria is the stress or psychological stress which a woman or a male undergoes during their transformation because of their incongruency of gender identity and phenotypic sex. And gender affirming surgeries are the surgical alterations of natal anatomy to align with one's gender identity. So if you see the frequency of transgender population, alone in US there are around 1.4 million transgenders. That is around approximately 1 to 200. In India, the prevalence of transgender is around 1 lakh. They are actually there are many more in numbers, but many transgender people in India they won't disclose themselves because of social stigmas or fear of discrimination. So the reason for transformation into a transgender, it is still not known. So the reasons may be like environmental factors, gender-based stereotypes, social factors that are hypothesized to play a role in the development of transgender. Let's talk about their anatomy. So genital organs, if you see a trans woman, means by birth they are assigned as males, and when they grow, they are considered themselves as females. So if you see their pelvis, it will be like almost similar, a typical male pelvis, like having a penis, testes, and urinary bladder, seminal vesicles, and all prostate, all these. Similarly, on the other side, if you see a trans man, means at birth they are females. When they grow, their gender identity is a male. So if you see their pelvis internally, they have like a typical female pelvis, having a uterus, ovaries, fallopian tubes, all this. So phenotypically, they are based on their sexual identity. The gender identity, it is mainly because of their brain. So the differences in sex or gender and behavior. The human brain is a variety of individual characteristics. We can't say there is like a typical male brain or a female brain. Always the characteristics varies between male and female. So one brain where they say, though physically they are male, but their brain may say they are females, their brain would be towards females more. So the sex of this gender dysphoria is still unknown. But few studies like BOA and SWAP in 2011 postulated that the fetal sexual brain differentiation mainly occurs during the second half of pregnancy. So he says that, he hypothesizes that the fetal sexual differentiation of brain in transgenders, it won't correspond to their development of body, means rest of the body. So this assumption implies that neuroanatomical features could be the causative factors for gender dysphoria. So the next study is by Rugrok et al. Rugrok et al. Concluded that the sexual differences in brain volumes notably found in insula. So you can see the green colored structure is the insula here, which is a submerged brain, and it is called as central lobe of insula or island of rain. So insula is related to human consciousness mainly. And of course our limbic system, because the sexual drive and sexual behavior, emotions, motivations, all these are under the control of limbic system. And basal ganglia has numerous functions. We can say like it including control of voluntary movements, learning, cognition, all these are under the control of basal ganglia. And not only these parts of gray mass, also the thalamus and hypothalamus, which are the parts of diencephalon, there is a variation between the sexes between the thalamus and hypothalamus as well. So that was about the gray matter. Next, the studies have also reported that findings of white matter volume in sex differences was notably found, especially in the cerebellum, cerebral lobes, and corpus callosum. So let us discuss one by one. So here in this image, here is the insula, which is a submerged brain, which is the central lobe, and in the gray matter which is covering the insula, it is called as insular cortex. So there were several studies which were put forth on the gray mass volume of insula. So I'll just show more. This is the most recent one. Giano Carlo to 2017, he compared the cortical thickness of insula in trans women with the cisgender woman. I hope you all know by this time who is a cisgender woman. Cisgender woman means their sexual identity and gender identity means the same. So those individuals are considered as cisgender women. So when they compare, he found that the insular cortex is found to be lesser thicker when compared to cisgender women, that controls. In Savick and Arvar in 2011, their findings were little different. They found that there are higher right insular thickness, cortical thickness when compared to the cisgender women. So this is a controversial paper. And the next one is by Zubair Elorza in 2013. They said that they found greater cortical thickness in right insula when compared to the cisgender men. And the same people published again in 2014, where the transgender women who are undergoing hormonal therapy, in them, they found decreased cortical thickness of insula when compared to normal. So inference, based on these all studies, we can just say that lower gray mass volumes in transgender women are seen when compared to cisgender women. So that is about the insula. So next about the rest of the gray matter. So here, if you see, this is called, this is the medial sagittal section of the brain, showing corpus callosum and rest of the gray matter here. And this one is the cuneus. This triangular area is called cuneus. In front of the cuneus, the arrow mark is called precuneus. And this is the parietal lobe. This is the paracentral lobule. And rest of it is the medial frontal area. So a paper which was published by Manzuro and Casido and Savick in 2017, they published that female to male transgenders, they displayed a thicker midfrontal, precuneal, parietal and lingual cortex. So here is the lingual cortex, which is best seen in the base of the brain, which continues as para-hippocampal gyrus. So Manzuri demonstrated that precuneus region and paracentral lobular region, parietal lobe and frontal areas, and also the lingular cortical regions were comparatively thicker in transgenders, especially from female to male transgenders when compared to cisgender controls. And they also found that the weaker connections between the cingulate gyrus. So here is the corpus callosum. The gyrus which is around it is called as the cingulate gyrus. So the anterior part of the cingulate gyrus, which is in front of the genu of the corpus callosum, is called as genual cingulate gyrus. So the connections between this genual cingulate gyrus with the insula are usually well established. But in transgenders, the connections were found to be minimal. They were weaker connections between the cingulate gyrus and insula. So these were the findings demonstrated by here. So most of the studies in humans are not confirmed, but there are many animal studies where they confirmed the sexual differentiation of brain. So testicular androgens during prenatal period, testicular hormones during prenatal period play an important role in sexual differentiation of brain, especially in rodents. So the testicular androgens transported to the brain via the androgen receptors. And testicular androgens which when they reach the brain via the androgen receptors, they synthesizes neuroandrogens, which further differentiate the brain into a male brain. Similarly, neuroestrogens, which act via the estrogen receptors during prenatal period, significantly contribute in the sexual differentiation into female brain. So apart from hormones, they also concluded that, animal studies concluded that preoptic area, which is located in the hypothalamus, and bed nucleus of stria terminalis, we can shortly say as BNST, they are also sexually dimorphic brain regions that are involved in the regulation of sexual, specific social behaviors and reproductive neuroendocrine system. So let's see where they are. So here is the section taken at the level of hypothalamus, that is a mid-sagittal section showing the diencephalon. So this one is the thalamus, and the colored one here is the hypothalamus. So these colored structures are the several nuclei which are located in the hypothalamus. So we are interested to know about preoptic region. So this purple one, what you are seeing on the anterior side of the hypothalamus, is called preoptic region, and it is again having two nucleus, lateral preoptic nucleus and medial this is the medial preoptic, this is the lateral preoptic nucleus. So the this preoptic area of the hypothalamus is involved in many physiological and behavioral process. And one of its main function is to manage body temperature, that is homeostasis. And the other function about this medial preoptic nucleus. So this medial preoptic nucleus is the primary brain region which controls the male sexual behavior. So lesions of this region, brain region, it inhibits the expression of male sexual behavior, and hormonal, chemical, or all the behaviors will be lost in them. And electrical stimulation of medial preoptic nucleus will enhance the male sexual behavior. So this was published by Agmo in 1997. So he says that medial preoptic nucleus of hypothalamus is responsible for male sexual behavior. So in rodents, they found to be that medial preoptic nucleus would be smaller in size in trans women when compared to cisgender men. The next is about the hormones, adrenal hyperplasia. So prenatal and perinatal hormones may influence the sexual differentiation of brain, which we know now. And some girls with congenital adrenal hyperplasia develop male gender identity. Means by birth they are females. Their sexual identity is a female. But when they grow, they consider themselves as males, and their gender identity would be male. That is because of adrenal hyperplasia. But this is not the reason for transformation in many of the transgenders, but few, this may be the reason. And next important is about BNST, that is bed nucleus of stria terminalis, which is also associated with the hypothalamus and limbic system. So this nucleus, bed nucleus of stria terminalis of hypothalamus in transgender women is found to be smaller when compared to cisgender men. This is published in Nelson's textbooks of pediatrics. We can have a look here. This is the bed nucleus of stria terminalis, and here is the amygdala. And from the amygdala, we can see the stria terminalis is the efferent tract going to the septal nuclei, which are located towards the hypothalamus. And we can see here, this is the bed nucleus of stria terminalis. So I want to show the bed nucleus of stria terminalis in coronal section as well. So these are the two lateral ventricles. The section is taken at the central part of lateral ventricle at the level of trunk of corpus callosum. And here is the head of the caudate nucleus, and this one is the lentiform nucleus, and lateral one is the putamen, medial one is the globus pallidus, and this white color tract what you are seeing is the internal capsule. So our bed nucleus of stria terminalis is located here. So this is the bed nucleus of stria, which is a very tiny nucleus actually. located in relation with the lateral ventricle. So this nucleus plays an important role in sexual behavior. The next study is on thalamus. Michael Vitorno et al. He demonstrated that a significant effect of like sexual orientation for thalamus and also the precentral gyrus, the gray mass volumes is cisgenders versus transgenders. So they found to be a different gray mass volumes in thalamus between transgenders and cisgenders. Next, moving on to white matter of brain. So we completed with the gray mass volumes. Now we are moving on to white matter of brain. So here what you are seeing is the mid-sagittal section of brain where you are seeing the corpus callosum. So corpus callosum is the largest structure of white matter in the human brain that connects right and left cerebral hemispheres, which connects the target areas between right and left cerebral hemispheres made up of commissural fibers. So the size of this, the shape and size of this corpus callosum also found to be different between transgenders and non-transgender individuals. So these are the few studies which were put forth about corpus callosum. Ebori et al. Reported that no significant differences were found in callosal shape between transgenders and controlled men and women. Okata et al. Found that the transgender people were more likely to have mental sex than their natal sex in terms of callosal shape in mid-sagittal section. And Remeti et al., he worked with MRIs and investigated the white matter microstructure pattern in transgender individuals. And he declared that early onset of gender incongruency and homosexual orientation and observation of that especially observed in female to male transgenders when compared with the control females. He found the difference in FA values were different in right superior longitudinal fasciculus and corticospinal tract, which is a descending tract, and forceps minor, which is a part of corpus callosum. So all these areas were found to be different, having different FA values. FA is can be better explained by radiologist, but I will just say FA is the measure used for diffusion imaging, and it is thought to be like reflect the fiber density, axonal diameter, and myelination in the white matter of brain. So here, this is the superior longitudinal fasciculus, the red one, which connects the frontal area to the temporal lobe. And this is a horizontal section, transverse section, taken at the level of corpus callosum. So we can see this is forceps minor and forceps major. So forceps minor was found to be different in transgenders when compared to cisgenders. Moving on to gender affirming surgeries. So that was the changes which we found in the brain. So let us see some surgical anatomy as well. So gender affirming surgery refers to the procedures that help the people in transition for their self-identified gender. So gender affirming options may include facial surgery, top surgery, or bottom surgery. Most people who choose gender affirmation surgeries report improved mental and quality of life. Apart from gender confirmation surgeries, there are some other treatments also, like hormone therapy, which is used to increase the masculine and feminine characteristics, puberty blockers, which prevents the puberty, and voice therapy to adjust the voice or tone or help with the communication skills, which was already explained. So coming to this gender affirming surgeries, so the goal is to alter the anatomy to match their gender identity. So that is the goal. So in feminizing a person, these are the surgeries which are done. One is the breast augmentation and orchectomy. Orchectomy means removal of erectile tissues like corpora corpora cavernosa and corpora spongiosum. These tissues are removed, and vaginoplasty, making a new vagina, and then facial feminization surgeries, and thyroid chondroplasty, the thyroid cartilage surgeries. In masculinizing, the surgeries are chest countering, hysterectomy. Hysterectomy means removal of uterus, and oophorectomy, removal of ovaries, phalloplasty, means making a new phallus or penis, and scrotoplasty and thyroplasty. So basically we can divide these surgeries as top and bottom surgeries. So top surgeries are mainly associated with the surgeries with the chest, and genital or the bottom surgeries to transform or reconstruct the genitalia. So here is an image showing some facial surgeries. So the yeah. So the cheek surgeries are done here, the jaw, where a surgeon may shave down the jawbone using fillers to enhance the jaw, or nose surgery, which is called as rhinoplasty, where the surgery to reshape the nose, making a broader nose in trans men and narrow nose in trans women, all this. And other facial surgeries like chin surgery and reduction of Adam's apple, thyroid cartilage surgery. So these are few facial surgeries. Next, moving on to breast augmentation. So breast implants. Here is the CT scan showing the breast implants. So the feminizing hormones usually induce the breast tissue histologically. So no need to do any breast implant operation. They can just attain the Tanner stage 5 with the Tanner stage 5 maturation with just hormone therapy. But if hormone therapy fails, then they can go for breast augmentation. So in breast augmentation surgery, two kind of implants are there. Here is the silicone implants, and the second image shows the saline implants, which gives the best breast counter. The other is the silicone injections, which is also done for breast augmentation and other tissue countering. But the silicone surgeries are prohibited. It is illegal in United States. Is illegal in India as well, because this silicone surgeries may cause lot of side effects. So the silicone surgeries may result in like the silicone particles. Here you can see the silicone particles. It may sometimes go into the bloodstream and cause the embolism, that is pulmonary embolism, or it may result in systemic autoimmune reactions. Sometimes it may lead to death. So that is the reason silicone surgeries are illegal. Next, about the chest binding. So we saw about top surgeries in feminizing. Now we are going to see the musculizing top surgeries. So chest binding is compression of breast tissue to achieve the masculine chest tumor, chest counter, sorry. So masculization is just done by the binding. Suppose the binding fails, they can undergo the mastectomy, removal of breast tissue. Next, about the vaginoplasty, creation and creating a functionally cosmetically acceptable neo-vagina. And there are several types of vaginoplasty. So vaginoplasty, there are three techniques: penoscrotal inversion, intestinal interposition, and perioneal vaginoplasty and skin grafts. So here is the image showing the penoscrotal inversion, and second one is intestinal interposition, which are taken from stowell. And these surgeries can be in a single or it can be in a multi-stage surgeries. So first about the penoscrotal inversion. So first image indicates this blue lines indicates the lines of incision. So incision would be taken, and the erectile tissues like corpora cavernosa, corpora spongiosum, they are all removed, and the length of the urethra is also reduced, and which is connected to the catheter here, and the glans is also reduced in size, preserving the dorsal neurovascular bundle, which connects to the for connecting in contact and to create a sensation of neoclitoris. And urethra is shortened and it is positioned inferior to the neoclitoris. And skin, penile shaft, scrotum, whichever the remains, they cause the remove the by orchiectomy. The procedure is called orchiectomy. So they remove all these structures, creating a new vagina. So this is penoscrotal inversion. The second procedure is phalloplasty. Phalloplasty techniques are taking the skin graft from radial free forearm free flap or from the anterolateral thigh flap. So the skin is taken along with the subcutaneous tissue and intact blood vessels and nerves. And this skin is rolled around the catheter. You can see in the second image, it is rolling around the catheter. And the rolled one is implanted. So in radial frio, it uses ventral side of the forearm in radial free flap surgeries. And the tactile sensations are kept in intact. And the dorsal nerve of clitoris is connected to this to have an erectile function. So phalloplasty means surgically creating a new phallus. So that was the bottom surgeries. And next moving on to phalloplasty, creating a phallus or a penis. That is two options are there, phalloplasty and metidioplasty. So phalloplasty is the surgery, metidioplasty is a non-surgical procedure. So in metidioplasty, only the hormones are given. So it is known as meta. Metidioplasty is otherwise known as meta, and it is describes as that work with the existing genital tissue and to create a new phallus with the help of hormones. Here in this image, the new phallus that is clitoris anastomose here.
Rajitha ma'am, please unmute yourself. Rajitha ma'am. Rajitha ma'am, please unmute yourself. You are muted.
Now am I audible?
Yes ma'am, yes ma'am. Continue.
Yeah. Now my screen is visible.
Yes ma'am, it is visible.
Okay. So here you can see the scrotal implants and testicular implants. So the scrotal implants, so here are these. So they are usually made of silicone. So silicone implants and the testicular prosthesis, which function as a pump for hydraulic erectile devices. So transgenders after gender affirming surgery. So that was we saw during surgeries. What are the surgeries which are done in feminizing and masculizing an individual? So after surgery, let's see some post-surgical anatomical changes as well. So gender affirming surgeries expand the options for physical transition among the transgender patients. So those whose gender identity is incongruent with the sex assigned to them at birth. So growing medical insight and increasing public acceptance have improved the access to and increased the demand of gender affirming surgeries. So after facial surgeries, usually there would be some swelling. So the swelling would be last for usually 2 to 4 weeks, and adequate time should be given by the clinicians to assess the anatomical changes during post-surgery for the edema and inflammatory changes to subside. Procedures for the transgender woman, those with the feminine gender identity, that is the breast augmentation, using implants, genital reconstruction, vaginoplasty, all these surgeries we have just seen. And some transgender women receive medically unapproved silicone injections. As I told earlier, it is illegal already. And it is done usually for breast augmentation and other soft tissue countering procedures. So this may lead to disfigurement, silicone pulmonary embolism, systemic reactions, and sometimes even death. Procedures for transgender men, that is masculine gender identity, like chest, they can undergo chest muscularization, mastectomy, removal of breast tissue, and genital reconstruction, phalloplasty, metidoplasty, scroloplasty, and erectile device implantation. All these surgeries can be done in them. And regular ureterography is the standard imaging modality which is performed to evaluate new urethral patency. So the clinician has to check the patency of the new urethra regularly. And he should even check for the other complications like leaks or fistulas which may form because of post-complications, post-surgical complications. So one thing, the clinicians must be aware of wide variety of anatomic and pathologic changes which are unique to the individuals who undergo gender affirming surgeries to ensure the accurate imaging interpretation. As transgender individuals continue to seek medical care for their transition, and the number of cases who seek gender affirming surgery is increasing in today's time, it will become increasingly necessary for radiologists to recognize the normal and abnormal imaging patterns associated with these procedures. So with this note, I'm winding up, and these are the references from where I took this presentation today. And before ending, I just want to say that if you are interested in knowing more of anatomy, you can follow my YouTube classes, YouTube channel. And you can follow my Instagram for regular updates on my YouTube channel. And at this juncture, I want to thank Prociem also, which is an online platform which provided me an opportunity to work as faculty and content developer in their forum. And I want to thank Next Fellow app, which is the companion for NEET PG. Our Supreme Court of India identified transgender as the third gender in 2014 and provided equal rights for them. So let us make sure that we treat transgenders as our fellow beings with due respect and consider them as a part of our society so that no one suffers any more agony and transformation, and let's support each other. And I want to thank Tata Steel for seeking only transgenders for earth moving machinery. This is a very new news about uplifting transgenders by Tata Steel. So thank you once again, and thank you organizing committee for giving me this opportunity, and a special thanks to participants who are the patient listeners.